Now, if we could hear about the Hong Kong experience from Dr. Chak Sing Lau.
Thank you very much. And I would also, first of all, like to thank the organizers, Dr. Chow and Dean Sheik, for the invitation to come and share with you some of the problems that we face in Hong Kong. I actually don't have any slides with me, so do allow me and excuse me. I will actually share my issues with you, actually, sitting down in my chair. The reason for not producing any slides, of course, is whatever that we actually show you, data from Hong Kong will be very much dwarfed by our plenary speaker. We've just seen that, in fact, in China, we need over 7 million doctors and nurses, not to include all the other allied health workers, to serve the whole of the country. And in Hong Kong, our general population is only just about 7.4 million. If we mobilize everyone to study medicine and to study nursing, then we might be able to serve China. So Hong Kong is a very small city. So if Korea is a small country, then Hong Kong is very, very much nothing. So what I would like to do is to perhaps to share with you some of the background of Hong Kong, the situations in terms of workforce and manpower situation in Hong Kong, which is a major issue for us. Now, as I said, Hong Kong has a population of 7.4 million, and we have not many doctors. The number of registered doctors that we have amounts to something like 13,700. Most of them actually work within Hong Kong. And we have 2 medical schools that train doctors, one from the University of Hong Kong and the other one, the Chinese University of Hong Kong. And up to, in fact, last year, we were producing something like 300 to 350 students per year, i.e. 300 to 350 doctors per year. But since last year, we've actually increased the number of student intake, and I will explain to you on this later on. And as far as postgraduate training is concerned, the Hong Kong Academy of Medicine was established in 1993. And the Academy of Medicine is the only statutory body for postgraduate training, specialist training, accreditation, and evaluation, etc. in Hong Kong. And we have, under the Academy, 15 colleges, 14 of them medical related and 1 dental college. And we train people in different areas of specialties and subspecialties, 58 medical specialties altogether and 8 dental specialties. And since the establishment of the Academy in 1993, we have now 7,500 plus fellows or specialists in Hong Kong and around 2,000 in training. Now, the situation with the healthcare provision in Hong Kong is kind of quite unique. Although we have over 13,000 or near 14,000 Hong Kong doctors, we have 2 major sectors, of course, the public and the private sectors. Out of these 14,000 or so doctors working in Hong Kong, only half of them actually work within the public sector, and the rest in the private sector. And the public sector includes the hospital authority as well as the Department of Health, and out of these 2, the hospital authority accounts for most of the service provision for the people of Hong Kong. So, and hospital authority actually accounts for something like over 90% of all of the inpatients and all of the outpatients care for the people of Hong Kong. And hospital authority employs half of the number of Hong Kong doctors. So the issue that we have is one that of manpower. We have 14,000 or so doctors, but only half of them serving 90% of the whole of the Hong Kong population. A little bit more information about hospital authority, and that is It is an overarching authority that runs all of the Hong Kong public hospitals. It's 42 altogether, and they are altogether almost 28,000 beds with 73,000 staff, nurses, allied health workers, etc. And the key challenge that we have in Hong Kong, not dissimilar to what we have just heard. First of all, a demographic shift, aging population. The total resources spent on elderly patients accounted to about 46% of all of the hospital authorities' cost of service 2 years ago in 2014 to 2015. And of course, the other major challenge is the burden of chronic disease. We've just heard, in fact, the increasing number of people suffering from diabetes, high blood pressure, cardiovascular, thrombosis, etc. All of these are also major issues for us. And with all these actually, growing, and with only half of available doctors looking after over 90% of these people, what can we do? And in fact, even for now, we seem to have a manpower shortage. And the recent survey done by the School of Public Health of my own medical school, we actually estimated that we are something like almost 600 doctors short in Hong Kong at the moment. And if we continue to work to remain status quo in terms of training doctors, etc., we will continue to have this major deficit of 500 to 600 doctors by the year 2030. So the strategies that the government, having realized all these problems, include, first of all, to address the healthcare manpower. And therefore, for the 2 medical schools since last year, we increased the number of student intake from initially 170 to 210 to now 235 each year. So we produce something like 470 doctors per year in 5 years from now. And we also would like to increase the training programs offered by more tertiary institutions, facilitate non-locally trained doctors to practice in Hong Kong, particularly those where Hong Kong has a shortage of. We will try to make the licensure examination easier, try to facilitate specialists who have already, gained specialization in certain areas not to have to spend the sort of 12 months internship that they are supposed to do. And we will try to also rehire some of our retired medics, as well as extending the retirement age. In Hong Kong, the retirement age now is 60, and there are plans to extend it to 65 years. And the government has also pledged to conduct manpower review every 3 years. And hopefully, the manpower gap can be closed by 2030. The second strategy is to try to address the public and private imbalance of medical workforce through reviewing the existing regulations governing healthcare professionals, improving the facilities, improving the supply of service in the private sector, day hospitals, equipment, etc. The other thing, of course, is to ensure high standard of practice by all, mandatory CPD, CPE, as well as medical credentialing, and I will touch on this later on. Voluntary health insurance scheme, we've just heard, as well as improving the public-private interface. And within the hospital authority, there is actually a budget of 200 billion Hong Kong dollars, which is roughly 25 billion US dollars, planned for expanding the hospital network in Hong Kong over the next 10 years. We also pledge to strengthen ambulatory services, including building more ambulatory centers, large-day hospitals for surgery, rehabilitation, endoscopy, diagnostic radiology, etc. And the other thing that is very important is to really promote primary care service. Actually, there was a pledge to do so since year 2000. We will hear a lot more about this later on. And as far as the academy, the things that we could do is to continue to really have a very stringent training curriculum for all of the major specialties. We will coordinate the framework for specialist manpower planning. We will try to collect data, from both the public and the private sector, and to conduct manpower survey amongst specialists. And of course, we are the agent that really ensure standard of practice for specialists. So we will continue to work towards a very stringent CME, CPD accreditation system, as well as medical credentialing. And with that, I thank you very much for your attention. And I would like to hear from you what you think of our situation and how you think we could actually further improve our situation as far as manpower shortage is concerned. Thank you very much.